Heart diseases are on the rise in India, claiming countless lives every year. But why? What are the causes? And how can we bridge the gap in cardiology care? Let's find out. Lifestyle choices and environmental factors play a major role in deteriorating heart health. Smoking, alcohol consumption, and pollution are among the top contributors. Smoking narrows arteries, raises blood pressure, and significantly increases the risk of heart attacks and strokes. Excessive alcohol consumption weakens the heart muscle, leading to high blood pressure, arrhythmias, and an increased risk of stroke. Air pollution triggers inflammation, leading to hardened arteries and cardiovascular diseases. In India, high pollution levels have drastically increased heart-related illnesses. Over 28% of deaths in India are due to cardiovascular diseases, and the numbers are rising. There is a dire need for trained cardiologists. India is facing a severe shortage of cardiologists. With the rising burden of heart diseases, the country needs 88,000 cardiologists. But today, we have only 5,500. The gap is huge. With a mere MBBS, it is practically impossible to progress as a heart specialist. However, a fellowship in clinical cardiology can help doctors become experts in the field. Texila offers a structured fellowship in clinical cardiology with critical care medicine in India, designed for MBBS graduates looking to specialize. Duration: 2 years. Eligibility: MBBS from a recognized university and registration with the respective medical council. This hospital-based program includes hands-on training, departmental rotations, contemporary research review, and mentorship from experienced faculty. Texila partners with leading hospitals across India, including Metro Heart Institute, Aditya Birla Hospital, and National Heart Institute, ensuring the best training. Texila offers a well-structured international curriculum, attractive stipends, real-time training, and access to vast online resources for continuous learning. Our faculty, student mentors, and academic advisors provide unwavering support to ensure you successfully complete the program. Becoming a cardiologist in India has never been more crucial. Take the next step with Texila's fellowship in clinical cardiology and save lives. Apply today.